Hi, my name is Mario Mendoza. We'll be addressing the issue of obesity today through novel interventions. So, in order to combat the growing problem of obesity in America, we have to come up with new and innovative techniques to address the growing problem. These issues and these techniques have to be employed on the community level, and you can't use just one single approach. You need to use a holistic approach that addresses the problem from many vantage points. So in this PowerPoint, we'll be addressing issues from behavior changes, genetic testing, pharmacotherapy. I'll also include the rationale for these techniques, as well as a framework for the study. So the first thing to address when trying to reduce obesity are the behavior changes. So how are you going to get someone to improve their overall health, reduce weight, and address the issue of obesity? And that is through behavior changes. Okay, so the goal of this program is to understand behavior change techniques that can change in the behavior in people. And that behavior that will change the communities to be healthier and to encourage healthier diets, more physical activity, less overeating, less stress eating. So overall, the goal is to address the negative behavior because obesity a lot of times is a problem of behavior. Next, this PowerPoint will talk about healthy eating. This is addressed and targeted at a general population. Anybody can benefit from healthier eating. So an effective program will train the general public to understand what a good caloric intake is. We'll address issues of nutrient density, portion control, and reducing sugars and processed foods. So overall, the goal is to get the general public to eat healthier, balanced meals. Next, we believe that community engagement plays a large role in reducing obesity. It fosters a collaborative and supportive environment at the local level, like community 5Ks, community fun runs for various reasons. The community engagement makes it more likely that individuals will adopt and sustain healthier lifestyles and reduce the overall obesity rates. Policy intervention can also play a role in reducing obesity. So you've got the policymakers at all levels, at the local level, state, and federal level. So basically the government and the private sector and the local communities work together to implement effective policy interventions. For example, if a community doesn't have playgrounds, parks, outdoor spaces for people to exercise, these are things that can be changed through effective policy intervention. So by addressing the wider diverse issues of obesity, policies can create environments that empower people to make healthier decisions and live healthier lives. Another issue that contributes to obesity is our own genetics. So in this PowerPoint, we'll discuss genetic screening for obesity risks that offer insights and can help inform someone of their issues related to their genetics, and a personalized and tailored prevention program can be developed based on their unique body type and composition. So while genetic screening can be effective, it's not a one-size-all-fits approach. To address the problem, you need to take a multifaceted approach, and genetic testing should also consider the environmental factors. For example, communities that are in food deserts will have more access to junk food and less access to healthier meats, vegetables. And so the diet for the average person in that community will be substandard. And you combine that with genetic issues, it raises a big issue of obesity. Next, pharmacotherapy. So this is an area that's been growing more and more. You may have seen people on the news advertising this drug or that drug for weight loss, and so this is somewhat related to that. But for the most part, we'll be targeting people with high body mass index. We'll be targeting individuals who have a difficult time losing weight, and we'll be targeting individuals that are too obese to exercise regularly in order to lose weight effectively. So, to get the most out of this intervention, okay, individuals should first speak to their healthcare provider before starting a weight loss medication. And those individuals need to be evaluated to ensure that they are a good fit for that medication. So the rationale for these techniques include we want to influence the community. We want to understand the social determinants. Overall, the goal is to create healthy eating, behavior changes, community engagement, all the issues that we mentioned, obesity and weight loss, is not a simple and easy thing to do at the community level, but it can be done. Now, the framework for this study will include appetite regulation, some minimally invasive procedures, making sure that the communities have outdoor spaces that people can exercise in, as well as affordable nutrition. I mentioned food deserts earlier. So communities have to have a reasonable access to good quality food. With pharmacotherapy, as I mentioned earlier, it's a great way for individuals with a high BMI to lose weight. But it's important that this is not a one-size-fits-all, and you do need to be evaluated by your physician in order to ensure that you are healthy enough to participate in whatever weight loss drug that you're trying to take. So lastly, genetic testing can greatly impact or it can impact how you tailor a weight loss program. So if you know that someone is not losing weight, you may discover that there's a thyroid issue or something within their genetics predisposes them to gain weight easily, or it predisposes them to have a higher density of fat in certain areas. So genetic testing is a good approach, but like I said earlier, no one thing will fix the issue of obesity. Thank you for watching. I appreciate any feedback. Thank you.